Are you willing to do whatever God called you to do?
Hey, what's up, guys? I'm Emmanuel Butts, and this is the Calling Collective, where we showcase different paths and callings so you can better understand and discover yours. We have a very special guest today, not a fake doctor, a real doctor. All right, and we got Dr. Kabithe here, and we're so glad to have you on. How you feeling today?
Pretty good. Thank you for having me.
Yes, sir. All right, yes, sir. How was work today?
Work was okay. Not too busy. I was in the office.
Okay,
Seeing
so
patients.
you have like office days sometimes.
Some days office days, and then usually Thursday, Fridays are surgery days.
Oh man, like every week?
Mhm.
Oh my goodness, that's a little intense. Yeah, but the end the week with a bang.
Yeah,
That's
that's right. That's
All right,
right.
so Dr. Kabithe, I'm just gonna get right into it. How did you? What did you always know you were going to be a surgeon? Tell us a little bit about your life and your early life, and
Mhm.
your family dynamic, anything that could have influenced where you are today.
Yeah. So, yeah, I didn't always know I'd be a doctor. So, actually, when I was younger, as a younger kid, I really wasn't a good student. I didn't
Mm,
go to school until elementary school. Before the age of 12, really wasn't good at school. Was never th- imagined that. We lived in Ohio, Toledo. My parents were African immigrants from Kenya,
okay.
and we moved to Kenya when I was 12 years old.
Mm.
And that move was
You moved to
transformative.
Kenya?
Moved to Kenya. My
Mm.
parents were they're from Kenya.
Okay.
My dad had come to America for school. My mom came. They got married, and we moved back as a family. I'm the firstborn of four kids. We moved back to Kenya when I was 12 years old,
Mm.
and so that change, that transition, really opened my eyes and made me a better student. Actually, just the
Mm.
environment, the change of environment.
So what about
Uh,
that environment?
I think it was, you know, not feeling out of place. I felt out of place
Okay.
growing up
Surround people more that.
around people who all looked like me,
Yes,
had
sir.
names like me. I
Yeah,
wasn't the weird
that's fair.
kid with the weird name. I wasn't the only black kid in class anymore.
Yeah.
So it was just a transition where I felt, at home.
Yes, sir.
Then teachers who looked like me, and teachers who the first time a teacher told me I was smart was in Kenya.
Wow, that's pretty awesome.
Yeah. So um, academics improved, and then when that happened, I thought, maybe I could be a doctor because you always hear, back then there was no internet. We
Mm.
looked at encyclopedias, and
Okay.
I remember reading, oh, to be a doctor, you got to be smart. So
Yeah.
I felt maybe I could be a doctor. So that's where it started. That seed was planted in Kenya.
Wow.
Yeah.
Were your not your doctors, were your teachers, I know you said they had an influence in that. Was that a deliberate, like, "Hey, I think you should be a doctor," or
No, no.
okay.
Basically, it was just to help me reach my potential. They
Mm.
were, you know,
So they're
But
just, like,
they were there to help
inspiration.
me, yeah, just basics, reading and math. I was poor at
Yes,
reading and
sir.
math.
Oh, okay.
Those are to be a doctor, to be anything in a career, you have to be
Yes, sir.
the basics, just
Yeah.
reading and math. So my math and reading improved.
Mm.
And then in Kenya, you take a national exam to get in high school. Going to high school is not
Really?
guaranteed. Yeah, back
Oh,
then.
man.
So we had to take you have to take a national exam.
Yeah.
And at first, it didn't seem I'd do well, but 2 years after we moved there, I took this national exam and did well.
Mm.
And so just really that was smart, going through high school, doing well in high school.
Yeah.
That's when I realized that's was the seed was planted. Just since I'm doing well academically and I am smart, I
I can
translated
transition.
that to,
Yeah.
I don't know where I was influenced. Just, doctors, seeing a doctor, seemed like something um, interesting to do,
Yes, sir.
looked like a goal that would be, I thought was achievable.
Wow.
And I'd seen people on, you see doctors on TV. There were no doctors in my family, but just
Mhm.
seeing people on TV, and I felt like a career. I felt like I knew it was hard, and I want to
Mhm.
do something that was hard.
That's awesome.
Yeah.
That's awesome.
Yeah.
People don't usually run the harder things.
Yeah. Yeah.
Wow, that's pretty awesome.
Yeah.
Okay, so you moved back to Kenya when you were 12.
Yeah.
Um, was your wife from Kenya?
No.
Okay, how did you okay, so we're in Kenya.
Yeah.
Do you leave Kenya
So
to
I was
go
in
to school,
Kenya for
university?
school. So I was in Kenya, high school, and then for college, I
Okay.
came back to the States for college.
Oh, okay.
Yeah.
What was that
So
process? How was that process?
so for me, being a U.S. citizen was easier.
Oh, yeah,
You
you
know,
were
a lot of
yeah,
a lot of people who live in other countries want to come to the U.S. for higher education
yeah.
because the higher education here is good.
Mhm.
And but for me, it was easier because
Okay.
of U.S. citizen. So I
Yeah.
just got my passport and went to Georgetown College, where my dad went to college. He
Mm,
came to America on a scholarship and went to Georgetown College in Kentucky. And he said the only place I'd go would be Georgetown College. So I came back to Kentucky,
yeah.
Georgetown College for undergrad. And I liked Georgetown College appeal because they had a good pre-med program.
Okay.
So they had a good pre-med program because to become a doctor, you have to do 4 years of college after high school, and then medical school is a post-bac course.
Okay, so you did biology,
I
correct?
majored in biology,
Okay,
yeah,
alright.
Georgetown College, and did pre-med, and then got to University of Louisville after for
Alright,
medical school.
alright. Well, how was your college experience, being back in the US after
Mhm.
being away in
Yeah.
Kenya?
Again, it was a culture shock again. There's a culture shock going to Kenya, but it was a positive culture shock. But then coming back wasn't. It was a culture shock again. But I adapted.
Okay, yes, sir.
Adapted
Awesome.
because the goal was, my goal in college was to become a doctor.
Yes, sir. So,
So
I
I
mean,
thought
these
so I
outside
thought
forces really didn't even matter.
Yeah, no.
Yeah.
At that point, just my goal was to become a doctor. So whatever happened, I just had to be Teflon.
Yes,
Just had
sir.
to get through it and get through medical school.
Yeah, tell us about that process of, doing that pre-med, that biology. What is that like? Because I know I had friends and they were happy to get maybe like a C plus
Yeah.
on some exams, So
Mhm.
what was that process like for you?
It's interesting because a lot of I always tell people, freshmen, about a large percentage of freshmen of any college class want to be doctors, until they realize what's involved.
What you gotta go through, yeah.
So you can actually major in anything to get into medical school. You don't have to
Really?
major in
I
biology.
didn't know that.
No, in fact, in medical schools they like diversity of backgrounds.
Wow.
So you can major in English, music. I had classmates in
I
medical
did
school
not
that
know that.
all kinds of majors, but biology helps because
Yeah.
it's
'Cause that's
at the
what
root of it. And I like biology, so I
Okay.
majored in biology. So I majored in biology. It's 4 years. You have to take a standardized test called the MCAT.
Mhm.
You have to get a good GPA and a good score, and that's how you apply to medical schools.
Okay, awesome.
Yeah.
All right. So it was a good experience.
Mhm.
It was probably challenging, but you say you like the harder stuff.
Yeah, it was. I mean, college, since I was so focused, and high school in Kenya really prepared me well. So
Oh.
college wasn't really hard.
Was it rigorous
It was
in Kenya?
Yes.
Oh,
Yeah,
man.
it was rigorous. So college, it was not that challenging.
Oh,
Yeah,
man.
yeah,
Wow. That's awesome to be
yeah,
prepared that way.
yeah. I was prepared for college.
Wow,
Yeah.
that is awesome. Okay, so now we transition to Louisville.
Mhm.
Have you met your wife yet or still no wife?
Not yet.
Oh, not yet. All right, so
Yeah.
now we're in the University of Louisville. Tell us
Mhm.
about the experiences there.
So I met my wife before I started though.
Okay.
So actually I was going to go to Cleveland for medical school
Really?
because I'd done a summer program there. It was like a diversity program where they're trying to recruit, trying to help African American medical students to improve their MCAT scores or just to kind of help students to know how to get into medical school.
Yes, sir.
And I spent a summer in Cleveland, and I loved it there at Case Western.
Mhm.
Um,
It was like an
very-
internship?
it was a summer program for
Okay.
college students. They Black students from all over the country.
Yes, sir.
So it was a enrichment program.
Mm.
Summers it was great.
Yes, sir.
And so I thought I want to go there for medical school because I was like, it's diverse. There
Yeah.
are people from all over the country who go to that school, medical school, all races. So I was going to go there.
Mhm.
And during my last year in college in Georgetown, I got a call from somebody from University of Louisville.
Mm.
So it was the head of diversity at University of Louisville. Her name was Mary Joshua. She called my door. Now she got my number. She called and she said, "Well, why don't you?" I said, "I want to leave Kentucky. I'm not.
Yeah.
Why don't you come? Have you considered University of Louisville?" I said, "No, I'm leaving Kentucky. I'm going to Cleveland." She said, "Well, why don't you just come and see what we have to offer?" I said, "Fine." She sounded nice on the phone, so I gave it. I gave it a look.
Yes, sir.
And during that visit, a young lady was working at the information desk,
Mhm.
and that was my future wife.
Oh.
Yeah.
What was that?
So I mean, I was asking directions how to get to the office.
Okay.
And I just thought, man, she's one of the most beautiful people I've ever seen in my life. So I was like, she was gorgeous. So
At some point.
but I had to focus on what I was supposed to do. But I thought at that moment, Louisville has some cute looking women. So
That's very
but,
nice.
I did the trip,
Yeah.
did the visit, and really I was impressed, with
Mhm.
Louisville and what was going on, how they were recruiting students that looked at me from over the country,
sir.
and I thought it'd be a good class. So that's how I ended up in University of Louisville.
That's pretty awesome.
Mhm.
Okay. Was there a program, would you say Georgetown prepared you for Louisville?
Mm-hmm. Oh
Okay.
yeah, Georgetown again had a good pre-med program.
Yes, sir.
In fact, most of us, like from Georgetown, we were like 10 pre-med students, and 9 of us went to University of Louisville.
Wow. That's pretty
And one went
awesome.
to UK.
Yeah, that's
Yeah.
pretty awesome
Yeah,
stuff.
all of us went. 9 out of 10 went to University of Louisville.
Okay.
Mhm.
All right. So going through medical school, it's 4 years after regular bachelor's?
Right.
Okay. All right. So that process of going through school and what would you say was your most challenging time
For
during your actual medical school?
Oh, it's intense. So the whole time is
Oh,
medical
okay.
school is nothing like college. It's like 10 times college.
Wow.
The amount of material,
Mhm.
you're in lecture, in a big lecture hall, and there's just they're cramming all this information you have to take down and note. Back then, now it's different. My daughter's in medical school.
All this electronics.
Now it's electronic. You can watch videos. You can speed them up. Back then, it was you had to be in lecture or you just read notes.
Wow.
And so it's a lot of information. There were quizzes every week and exams every so many weeks. And so you had to it was intense. You had to really have a way to study to be efficient.
Oh,
You
yes.
had to be efficient with your time, and you had time management was important.
Yes, sir.
But we had good support. We support each other as students, and you get through it. Yeah.
Was there a big dropout rate or how many?
There were some, but not huge because
Okay.
it's hard to get in.
Yeah, by then
but
you're pretty much vetted.
you're vetted.
Okay.
But there are some. There are some.
Okay. Yes, sir.
Yeah, there's some who don't pass the certain exams to get to the next step, and it happens. It's because it's hard.
Okay.
It's hard.
Yeah, and so is that the MCAT at the end of that, or
So the
MCAT is to get
The
in?
MCAT is to get in, and then
Okay.
in medical school between second and third year. So the first 2 years I focus on lecture. So you're doing basic sciences. You're like
Okay.
learning about theoretically. You're learning
Mm.
physiology, anatomy in a lecture mode,
Yes, sir.
right? And the last 2 years are clinical or hands-on. It's when you go to the hospital.
Okay.
So that's the last 2 years, mostly the third year. So between second and third year, you take a big exam. It's the first step. There are 3 exams you take for licensure. And the first one is the hardest.
Okay.
And that's what everybody stresses about because you have to pass that test to start your
people know.
clinicals
Yeah,
the third year.
Okay.
And so, I remember we had time off to just study all day. And you just had to, I'd make your schedule to study.
Yeah.
I'd go to the library and, because that test, you have to pass it to go on.
Yes, sir.
So took it, passed it, and then went to third year.
That's
And
awesome.
third year is when you take your different rotations. You do medicine, you do pediatrics, you do surgery, which is my goal. OBGYN, you do the basic they're called clerkships. So you do all those during third year. And then that's people decide what they want to do.
Yes, sir. Okay.
Yeah.
All right. So from going to the hands-on, was that a culture shock for you?
It's a different environment, but you're excited. Well, it's exciting because as medical students, you've been in class all 2 years. You're finally in the hospital as a doctor. You think you know.
Oh yeah, you're like
The thing is, the third year medical students think they know a lot, and they
Yeah.
get there, and you're like, I don't know anything. Yeah, because
wow.
in the hospital, you realize there's a lot you don't know.
Yeah.
So it's always humbling.
Yeah.
They take you down a notch.
It should be. Some people probably,
Yeah, some people think they know it all, and they're showing no, you don't know anything yet.
Wow. I just have an actual funny caveat. My wife went to dental. She was going to be a dentist, and then they started doing probably alongside probably like a clinical. But so they cut a piece of his gums open. She said right there. She went to the bathroom. She couldn't do it with just. She said it was too much, And so it's like I'm glad that didn't deter you from continuing. So I know you got to have a strong stomach for that type of stuff, or does it just not bother you?
So not everybody has surgery. So there are
Okay.
people who become doctors who they don't like to see blood and guts. You can do
Really?
psychiatry. You can do
Oh yeah, that's
pathology. You could do radiology. There are fields of medicine where you don't have to see that.
Yes, sir.
Yeah.
Okay. And what exactly is your area?
So I'm general surgery. So I do surgery, in the abdomen. I also do surgery. I do a lot of surgery for patients who are on dialysis
Okay.
to create something called dialysis access, connecting vessels together. But using a scalpel and cutting and blood doesn't gross me out.
Oh, yeah. So did you choose that during the clinicals, that pathway?
So I knew before.
Okay.
And so I prepared myself. I planned my clerkship so that I do surgery like in the middle. So I had experience in the hospital. So usually people want to do surgery early on. Now some people think they want to do it,
And then they get
they get into it like no.
Yeah.
Yeah.
Okay. Well, that's good.
Most
Most people
people
change course. So
Yeah. Most people to do surgery, you have to know early on.
Okay.
Yeah.
Yes, sir. Did you have any mentors that got you maybe like open your eyes? You're like, okay, I definitely want to do general.
Yeah. During the rotation, I had attending, Dr. Tuxon, he was a mentor in some residents. So there were people along the way who encourage you.
Yes, sir.
Encourage me and let me know I can show help me realize I can do it, and they give you hints and support.
Yes, sir.
But yeah, they're mentors.
Yes, sir. That's
Yeah.
pretty awesome.
Yeah.
Yes, sir. All right. So we're through. No, okay. Let's go to the end of medical school. What was that like? That finally getting you probably do you get a white coat before that time?
I think
It's
the
another
white coat
ceremony.
ceremony is nowadays they do it for the incoming, like they do it before you start medical school.
Oh
It's
man.
done. The white coat ceremony is when you get you're accepted to medical school. They have a
Okay.
ceremony for all the first years before they start school.
Okay.
That's the white coat ceremony.
Yes, sir. Well, when you were going through, it was the same way?
Mhm.
Oh,
Yeah.
okay, okay.
But you don't wear the white coat until 3rd year.
Oh, well,
So
okay.
now 3rd year when in the hospital, that's when you actually wear the white coats.
Right.
Yeah.
Okay.
Yeah.
And so what is your position at that time when you're doing clinicals? Do they
You're
call you?
3rd year, so you call it you're a 3rd year medical student.
Okay, and you're just observing or?
You're seeing patients. You're seeing patients.
Wow.
So, you're in the military. So medical school training, especially surgery, it's hierarchical. There's at the top is attending,
Okay.
and at the bottom is the medical student.
Oh, man.
You relate to that in terms of like how the military has
Yes, sir.
hierarchy?
Definitely, yeah.
Yeah. So as the medical student in the hospital, you say the least.
Okay.
You listen. You spoke when spoken to.
Mhm.
When asked
Yeah.
a question.
Yeah.
And so you're learning. So a medical student can see a patient,
Yeah.
take history, write notes, and then they will present to the resident. Residents after medical student residency,
Mhm.
they present to the resident or sometimes the attending. Who the attending is a certified physician
Okay.
who's teaching a professor.
Okay.
And so the medical student is being graded based on what they see a patient, they present, they come up with a plan, and they're doing that under supervision of residents and attendings.
Okay, so you're in there seeing the patient, but
That's a
the
student.
attendee is watching the entire.
No, they're not there.
Okay.
So if you're ever a patient in a teaching hospital, you see so many. They say, I see so many doctors, right? Because the medical's seeing them first,
Oh, okay.
and then they're seeing then the medical student reports to the resident, and then they go with the resident to see the patient again.
Okay.
So the resident is a doctor. See, the medical's
Okay.
not a doctor yet. So they see the patient with the resident, and the resident presents to the attending, gives a plan. And then the attending will come in later.
Mm.
Yeah.
Oh, man.
Yeah.
Okay, so I guess I'm not so the resident is who? A higher student?
So a resident is someone who's graduated from medical. We haven't got to residency yet. So residency is
okay.
after medical school.
Oh, okay.
Yeah.
All right, so we went to clinicals as a student, you're seeing patients. All right, so now once you graduate medical
You
school?
graduate medical school,
Okay.
then you get into a residency program.
Oh, okay.
Yeah. And those vary depending on what you do. Some residency are 3 years.
Mhm.
Some are like internal medicine or family practice 3 years. And then like surgery, what I did is 5 years.
Really? Man, that is in for the long haul.
Yeah.
All right, so what was that residency like?
So residency is, for surgeries, pretty rough because you're in the hospital a lot.
Wow.
Ranges from 100 hours to sometimes 120 hours.
Wow.
Back then it was,
Oh, my goodness.
yeah, you're in hospital a lot. So you just have a lot of responsibilities, doing a lot of seeing patients in ER, seeing patients on the floor, and then scrubbing on surgeries all day.
You said you're scrubbing?
Doing surgeries, like
Oh,
going in,
actually?
scrubbing in on surgeries.
Oh,
as a resident, yeah.
Okay, wow.
So you got to get up. You get surgery rotation. Just like for students, that's why surgery is one of the hardest. It's a hard rotation because the student has to get up at 5 has to go to the hospital at 5 in the morning to see the patients
Wow.
before
Oh,
before the resident
pre-op.
before the resident sees the patients.
Oh,
Yeah.
man.
And so they can present, and the resident rounds, and the resident presents the attending. See that hierarchy?
Yes, sir.
Yeah.
Yeah.
So residency for a resident, it's every day like that. For the students, only doing that rotation, right? For the residents, it's 5 years.
5 years of it.
Yeah.
Oh, man. Do you have any times during the time where you maybe felt like you had close to a breaking point or,
No. I mean, some rotations were not as hard as others. I mean,
Okay.
trauma during residency was probably the most rigorous because it's every night on call. So you go 24 hours plus go home, come back another 24 hours.
Oh, my goodness.
Yeah. So that's probably was the hardest rotation.
Yeah, and just because of
Real
lack
residency.
of rest.
Your lack of rest
Yes, sir.
and your go.
Man, I bet.
Car accidents coming in, gunshot wounds coming in, stab wounds coming in.
Oh, so it's
Take care of those.
the ER?
The ER, yeah. ER, then the surgery.
Okay. Oh, okay.
Yeah.
That makes sense. All right. So you're at the residency for 5 years. All right. So after the residency, or when did you do all of this? Did you do it at the same place?
No, I did my so I did medical school at University of Louisville. I did my residency. I ended up going to Cleveland for residency.
Oh, okay. So that's full circle moment. Head back to Cleveland.
Yeah.
Okay. Was it the university from before?
Mhm.
Okay. Awesome. Okay. And then after residency, what is the step after that?
So after residency, you can do a fellowship. I didn't do a fellowship. But after residency, after training, then you get a real job. So my first job was in Middletown, Ohio. I was in Ohio for about 12 years.
Okay.
Doing surgery, and then I came to Jenny Stewart in Hopkinsville in 2014.
2014.
Mhm.
Okay, so it was my understanding that you were from Hopkinsville at first.
Mm-mm.
That's what it made it. That's what I guess I thought. That's what people were saying.
Yeah, my wife is from nearby Hopkins.
Oh, okay. Where's
She's
it?
from
Katie's.
Katie's.
Oh, yeah, yeah. I've
Yeah.
been out to Katie. And this is a country town.
Yeah.
It's a very small.
You been there?
Yes, sir. Yeah,
Okay.
yeah. I've been there.
Yeah.
Yeah, that's pretty awesome.
Okay. She was born and raised there.
Born and raised.
Mhm.
Okay. So being so after all of that schooling, I know you probably felt prepared.
Mhm.
You had to feel prepared doing all of that. And do you get paid during, your school years? Not before the residency at University of Louisville? Or
As a student, no, as a student, so you heard about student loans, medical students take out a lot of loans.
yes, sir.
So to medical students, you don't have time to work. So you're living off your loans.
yes, sir.
It's
Okay.
paying for your rent and food. So you don't get paid. So in residency, you get paid.
Okay.
So
What type of pay is that?
it's a survivable. It's a survivable.
Just so you know,
Yeah,
it's all over. Okay.
yeah, it's nothing to write. You're definitely not paid worth your time
Okay.
because you're training.
Yes, sir.
You're working, but you're also in training.
Okay, that's fair.
You're a doctor, but you're not board certified in the field yet.
Okay, so when did you become board certified?
So that happens after. So when you finish residency, you take your board for surgery. You take a board exam.
Okay.
During the last year, there's a written exam, and then there's an oral exam.
Yes, sir.
So the written exam, is a written exam,
Mhm.
and the oral exam is back then it was in person. Now it's virtual. But back then, you went to a hotel and a room, it's cleared up, and it's you and two professors asking questions, kind of like this. She'd be like we'd be the asking questions,
Mhm.
and she'd be the surgeon who trained. Like,
She was a little nervous.
yeah, imagine that's how it was like.
All right, and they're just asking you random medical questions.
Random questions. Like they make a scenario of a patient. What would you do?
Oh, okay.
If this happened, what would you do?
Okay.
And
How'd you?
and if you mess up, they can just lead you down the wrong path, and you flunk out. So
Oh man, how did you do on that? Well, you're a doctor.
pass, yeah, years I passed.
Yes, sir. All right.
Yeah.
Yeah, that's pretty awesome.
So that's for surgery.
Yes, sir.
Mm.
Okay.
Not all different fields have different ways of doing it.
Okay. Okay. So with all of that, how did you even? Did you and your wife like keep touch during this time, or because that's a lot? That's
We're married.
yes, sir.
Yeah.
All right.
Had kids too.
Okay. Where did that fit into Ella?
I don't know how it happened.
Oh man.
So yeah, so when I was in Cleveland, two of our kids were born in Cleveland
Really? Oh, okay.
Mhm.
At the residency.
during residency.
Okay.
During residency. So they were all conceived during residency because our last one was born like just when I finished when we first moved to Middletown, like a month after we moved to Middletown.
Wow.
First job he was born.
Okay.
Mhm.
And what did she actually do for work?
She's a nurse.
Oh man, that's cool.
Mhm.
This is
Yeah, I forgot to say she was a nursing student when I met her.
really that's
Mhm.
pretty awesome. Does she work at the same hospital?
She's been working at Tree County Hospital.
Okay.
Mhm.
Okay, that's pretty
Yeah.
man. That worked out perfect actually. I'd say that's a little blessing right there for
Yeah.
your wife to be a nurse. She understands the life.
Yeah, so she understood the life, and residency was a lot.
Yeah, I bet.
So you
And
have to do
then
it.
having 2 kids, you had 2
She
kids.
had two kids, and no family around, so she's
Yeah.
pretty much doing a lot.
That sounds like military
Yeah.
life a little.
Oh, really?
bit.
Yeah, she's doing a lot.
Yeah.
And the kids were born within 3 years. So
Wow.
it was rough.
Okay.
Yeah.
So now, looking back, I know it's worth it. I believe probably now,
Mhm.
So, what advice would you give to somebody that wants to go down that path or, wants to get into that?
So depending on the age, but it's if you want to become in medicine, you're talking about medicine.
Yes, sir.
I mean, yeah, it's the fundamentals. Reading. You have to like to read. If you can't do it well, you got to practice. Everything can get better with practice. That's the
Yeah.
thing. People may have a weakness or they feel like not good at something, but you never really know unless you really get better, get
Dig
tutoring.
in and
I mean, I
practice
had to
it.
get tutoring.
Wow.
Got tutoring, got my math skills better.
Mhm.
You get better as a reader as you read more. Because that's what it comes down to. What school is all about: getting information and spitting
Yeah.
it out. Right?
Mhm.
Take a test. You're given information, then you get a test. To get good at that, some people need more practice than others. Some people it comes natural. Don't get me wrong. Some people are natural good students, right? They get straight A's. Why don't you try? Well, not all of us are like that. We just need some people need a little extra effort, but you can get there.
Yeah.
Yeah.
It's attainable.
Yeah, it's attainable if you put the work in.
Yes, sir.
Yeah,
Definitely.
like everything in life.
That's true. That's so true.
Yeah.
You look at everything.
Everything in
It's usually fundamentals.
Oh, yes. What's up?
I wanted to ask. Sorry, also had to ask because I feel like some of the viewers might be thinking, but I'm not sure if you watch Grey's Anatomy. Was But as a Grey's Anatomy fan, I would ask, if you see the show and you do see real life
Yeah.
general surgeon,
Yeah.
are there any similarities? If not, please make us aware.
That's a good question.
There are some, and the clinical stories are factuals that can happen. The outside relationships are not real.
Those aren't related.
And just to say, my daughter wanted a strong influence on her was Grey's Anatomy, watching Grey's Anatomy, going to medical school. So yeah, some of it's relatable, but some of it as far as the interpersonal
drama,
stuff,
yeah.
that's not real. So it is it's because it's written by a doctor, so it is.
Really?
Yeah,
I didn't know.
yeah.
You know that?
Yeah.
Oh man, I don't even watch that show. So. Okay. All right, so in all of your years, so how long have you been practicing?
So I started in 2002.
Man, wow.
Yeah.
So how long have you been no, not how long have you been practicing. What would you say is your most challenging maybe scenario or surgery? I don't know if you can't talk about that. I don't know.
No, I can, and it's actually my book, so I talk about stuff like that. Everything we talked about is
All right, we're gonna plug the book too. All right, so we can
Everything is the
buy the book.
But I always liked surgery on blood vessels. That's always been something that I'm interested in. But as far as the hardest surgery, I would say was a surgery I did on a patient who there's something called an aneurysm. You ever heard of the word
Yes.
aneurysm? So aneurysm is something when there's a blood vessel that's larger than it's supposed to be, basically.
Okay.
You've heard of a brain aneurysm?
Yes, sir.
It can rupture, but you could also have an aneurysm that's called the aorta. The aorta is the biggest blood vessel in the body.
Wow.
And it runs in the belly. Okay, and when that ruptures, you can just bleed out into your belly.
Wow.
And you could have an aneurysm and not even know about it.
Oh man.
Okay, so there was a time when a patient, and that's usually done by vascular surgeons who've been fellowship trained usually.
Mhm.
And I didn't do a fellowship. So there was a time in our hospital as a patient who was admitted, no one knew they had an aneurysm.
Wow.
They're admitted with belly pain, and then I got called. I was the only surgeon around, and I was told the patient has a ruptured aneurysm. And I was the only surgeon around. I'd never done this repair by myself. So that was challenging, scary, and it took everything inside me to get it done, but the patient survived.
Yeah. That's a
So
blessing.
that's probably the hardest and most rewarding surgery that I ever did.
Wow.
Yeah.
Okay, was that so you said they were admitted and no one knew?
Yeah, the patient had some discomfort,
Okay.
had some symptoms, but they hadn't gotten a scan to look if that was it because it wasn't. It wasn't picked up. It wasn't something that they suspected. So when the patient was in the hospital already, because if the patient was in the emergency room, I would have said transfer the patient to another hospital so we can do it.
Yeah.
But they were in the hospital, so there's no way to transfer it because they were bleeding out.
Oh, so it's time sensitive.
Yeah.
Okay.
So that was probably the hardest surgery I ever did.
How big is because when I think blood vessel, I'm not thinking like it's something you could even operate on. So how big is a blood vessel? If you could compare it to.
It depends on where the body is. Your femoral artery that goes to your leg is about the size of your finger.
Really?
Right? But the aorta that goes in your belly and splits into two, it's about that size.
Wow. Do you pretty much like patch it
Like
like
an aneurysm, but in an aneurysm it gets that big.
Oh, so it's swollen.
It gets swollen.
Yeah,
It
yeah.
ruptures. It tears open. It
Okay.
tears.
So for that operation, what type of work are you doing?
We're just sewing it.
Sewing it to it?
We're just putting an artificial tube to replace that swollen part.
Oh, okay. So you basically place a tube inside the blood vessel to okay.
Yeah.
Oh man,
Force it. Yeah.
that's just some real work.
It is.
I don't know if I'm glad you went to school for all that time. Yes, sir. That's pretty good. Okay, Dr. Kabithe, you got any last words for any of the viewers, that and like I said before, seeking the medical route, but they may have some Grey's Anatomy type, views of it, or maybe they think it's unattainable. What would you say to those type of people?
I think it's attainable. You have to. Everybody has to know their strengths and weaknesses.
Yes, sir.
I think some people, we all have strengths. I mean, I love basketball, but I'm not that good at it.
That's fair. Yeah.
So you have to. But as far as when it comes to academics, a lot of times you really don't know your potential unless you're in the right environment.
Wow.
The right teachers. The teacher's going to believe in you. Your parents, your parents have to support you. For me, moving to Kenya, the thing about moving to Kenya too was to have the support of not only my parents but also family,
Yeah.
aunts, uncles.
Yeah.
My grandmother, who wasn't even literate,
Wow.
would ask me how I'm doing at school.
That's
She couldn't even read.
Yeah.
Yeah, so she was concerned about my academics. So having that support from your whole community that plays a part. No, a student can't do it on their own. They can't do it
Yeah,
on their
no
own,
one can do it.
right?
No. Yes, sir.
No one can do it on their own. You need to have that support.
Yes, sir.
And so reach out to your community, and it's up to the community to support a child,
Mhm.
and so they can reach their potential.
Yes, sir.
Yeah. But for the actual individual, yeah, you have to really put in the work.
Put in the
Yeah.
work.
Hard, success doesn't come from take it easy, right?
Yeah.
You
It's
know,
great. Yeah.
into the military, you had to go through some difficult things to get
Yes,
there.
sir.
That applies to everything, especially medicine.
Yes,
Yeah.
sir.
Yeah.
All right. And last but not least, we're gonna ask you about this book. Give,
Okay.
give us a plug and
Which everything you've talked about.
yes, sir. That's it right there. All right, so you just got a quick trailer. All right,
Yeah,
it's
so it's like a big summary. So so it's a memoir that I decided to do. It took a couple years, and it's called Underestimated,
yes, sir.
and it's underestimated my unlikely journey to becoming a surgeon. And I wrote that really was dedicated to my dad, who passed away in 2022, and dedicated to him because he always wanted to write a book, but he couldn't because he had Alzheimer's dementia, so he could never write one. And
Okay.
the first chapter I talk about his life a little bit, and then my brother passed away towards the end of the book, and he passed away last year in October. So
Oh,
I
sorry.
dedicated the book to him too.
Yes, sir.
So-
I saw that picture you posted of the two.
Yeah.
Yes, sir.
So I dedicated the book to them, but it was really just about my journey, and it's for people who it just shows that you can have hardships, or you can have a point in your life where you're not looking like you'll be successful,
Mm.
because that's being underestimated.
Yes,
You
sir.
become successful, right? If you
Yeah.
become successful and you didn't look like you'd become successful, that's being underestimated.
That's pretty awesome.
Yeah.
Yes, sir. Because it is a hard road. Yeah, but
It's a hard road, but it's doable, and hard things are doable if you get all the things right.
Yes, sir.
Yeah.
Yes, sir. Yeah, that's inspiring, Dr. Kabithe, because you can apply that to any area of life.
Any area,
Yeah, it's not just
Yeah.
being a surgeon, but
any profession.
yes, sir.
And especially, it's very applicable, I think, to STEM, science, things in
Mhm.
science,
Yes, sir.
because that's something that a lot of kids who look like us don't see it as attainable, but it
Yeah.
is. And I
Yeah.
think that's really applicable for where you see not many kids who look like us trying to do that.
Yes, sir.
Yeah.
Yeah,
Mhm.
that's pretty good. So, how would you try to influence those I know probably doing things like this, meant to be mentoring.
Yeah, meant to be
Yes, sir.
mentoring.
Yeah.
Yeah. Just being visible,
Yeah,
being visible.
Yes, sir. Because honestly, we're in a part of a program called Meant to Be. It's a mentor group for young kids or young boys, and so but I met Dr. Kabithe there. I'm like, I didn't even know all of these great people were around this area.
Wasn't that a great
But that
program?
exposure,
Yeah, exposure.
will show you, the
Mhm.
possibility.
It was the live museum.
Yeah, yes, sir.
Yeah. It's just knowing that there are people who look like who did this. Then they can actually light bulb go off. Oh, I can.
Oh, that's attainable. Yeah, I can
Yeah.
do it as well. Yep.
Mhm.
Yes, sir. Dr. Kabithe, we really appreciate you coming on today.
Thank
I'm gonna pray us out, and that'll be it.
Okay.
So, God, we thank you for this time with Dr. Kabithe, Father. We thank you for all the wisdom he's poured out, and pray that you would just bless him, bless his family, and bless his surgeries. Lord, guide his hands. And Lord, anybody who's considering this calling, this pathway, Father, we pray that you would place people in their life like Dr. Kabithe that will encourage them and show them that it is attainable and that it's doable. In Jesus' name we pray. Amen. Amen. Later, y'all.